This is Peter. He recently turned 50 and lives with his wife and children. After a brain injury 8 years ago, he has received treatments in a rehabilitation center. Peter tells a general practitioner that he suffers from fatigue and is agitated. 6 months ago, he was promoted to a manager position, and he feels the position is quite demanding. In recent weeks, he has been unable to concentrate, and he forgot a few appointments. His wife experiences that he is more irritable than usual. Moreover, he now often lacks the energy to play football with his children, and when he does, he regularly suffers a physical injury. The GP asks occupational therapist Maaike to analyze Peter's daily functioning. She uses measuring instruments to assess his activities. She asks Peter to fill in a fatigue questionnaire to register which work tasks require little and which tasks require a lot of energy. The inventory shows that the frequent questions from his colleagues disrupt his concentration and cause mental fatigue later that day. Maaike uses psychoeducation to explain how fatigue works and teaches him to recognize its signs. He learns how to properly distribute the various work tasks throughout the day and how to reduce stimuli. By scheduling effective moments of rest, he can recharge his battery. Maaike visits Peter and his family at home. She provides insight into how his past brain injury affects his daily activities. The explaining and advice leads to better functioning in daily activities and more understanding and acceptance of his situation. Nowadays, Peter goes for a cycle trip through nature after work, before the family has dinner. Treatment by the occupational therapist gives Peter better insight in his mental energy level and his emotions. He is less agitated and can handle more activities. There is less struggle and he has more energy to play football with his children. Occupational therapy focuses on analysis of daily activities and roles, assessment and applying effective strategies, and training of applying the advices into daily life. As a result, the client can continue to perform his important activities. Consider an occupational therapist when your client with brain injury or his relatives gets stuck at work, hobby, or relationship, or experiences problems such as fatigue or agitation, even when the brain injury was sustained for a longer period of time. More information can be found at a National Occupational Therapy Organization or ask for an occupational therapist in your area.